So anyway, I really appreciate everybody coming out on a Tuesday night. You know, it's kind of hectic and 6 o'clock rush hour, so I really appreciate it. I'm looking around the room and I'm seeing literally a who's who of doctors and professionals in this room, and I really appreciate your support. The reason that you're here tonight is to find out about regenerative cell therapy. We have some special guest speakers here tonight that are going to help me with my presentation. I am not a doctor, I am not a medical professional, I'm a marketing person. So the presentation that I have for you is the business opportunity for medical professionals to add regenerative cell therapy to their practice, increase their income. So that's going to be my side of it. If you have medical questions, please ask the medical doctors because I won't give you a good answer. So let's get started here. So our first guest speaker, besides me, is going to be Dr. Dan Royal.
Should I put my glasses on?
So,
So I recognize you.
is that you? All right. So he's got all these initials next to him. All the doctors in the room know what those are, right?
Why did you put all of them up there?
Because that's what you sent me. I just made them up.
Left some out.
So
Yeah.
Dr. Royal is a certified tribal practitioner. He works with the Turtle Healing Band Clinic. He's actually been helping us do a lot of our therapies here in town. All the patients I've sent to him absolutely love him. He takes an approach to their evaluation that I really love. Instead of just walking in and doing a drive-by IV infusion for regenerative cell therapy, he sits them down, asks them what's going on in their life, what's going on with your body, what else do we need to be taken care of, and he does a whole comprehensive approach, which I really appreciate. In 2011, he filed for a patent for a method of obtaining the pluripotent stem cells from the blood, and it was converted to utility patent in 2012, so that's pretty good. Our second guest speaker is going to be Sherry Lund. Thank you so much for coming in. She actually came in from Newport Beach.
No, I came from Phoenix.
You did come from Phoenix. Okay, well she's from Phoenix,
Going
but
to
she was
Newport tomorrow.
on her way to Newport. Okay, great. She actually owns, her and her husband co-own the Celebration Stem Cell Center.
Oh.
This is the lab that's going to be making our product for us. After a lot of research, Mark and I spent a couple months traveling around the West Coast, visiting different labs to see what they had to say about their product, about the industry, how they could help us, how they couldn't help us. And after talking to several people, we ended up just loving Sherry, loving her lab, loving her commitment to quality and to doing things right in her certifications. And we really like that. So thank you, Sherry, for coming. And then our final guest speaker is going to be Dr. David Harris. Dr. Harris, when you guys get your packet of information, as a matter of fact, Melissa, you want to start passing those out? The very first page in this packet of information is a note sheet. The pens are right next to it, so you can take your notes. The very last packet inside that packet is 72 pages of his CV. When I printed this out, 72 pages, and I thought, I'm not printing that for 20 people, but I did, because I wanted everybody to see how impressive his history is and his experience in the stem cell industry, among other things. But we couldn't find a better qualified person to support us in the lab in creating our product and making sure that we get educated in the right way. So, why are you here? You're here to learn about regenerative medicine and stem cell therapy. So who we are, the name of my company is Spugs. I'm the CEO of Spugs. The program that we're doing is lifestyle cell therapy. So you probably wonder, where did Spugs come from? It's a not, common name. Well, we tried for 3 years to come up with a really unique name for our marketing and advertising company. Had a hard time. Everything was taken. Everything was close to something else. At that time, back in 2012, my grandson was just a few years old. He comes walking into my office and I said, Mason, what are your favorite 2 words? And he said, spiders and bugs. So I said, Spugs it is. So that's how we got Spugs. And then our program is lifestyle cell therapy. So, as a medical professional, as a practitioner, you can seriously add $40,000 to $60,000 per month to your practice by offering the regenerative cell therapy. Now, that's not something that's going to happen overnight. It's going to take some time to build a clientele. But here's the good thing. Besides you offering the cell therapy to your current patients, we'll also help you with the marketing. We'll also send patients to you. So one of the reasons that we do this is because we know how hard it is for small practices to stay in business. I mean, with all the billing that you have to do for insurance, trying to find new customers, trying to find a unique niche. We wanted to find a way to help, the small solo medical clinics, to be successful. Our slogan, you'll see it at the top of things, is for a better life. But it's not just for our patients. I mean, we think cell therapy is going to give them a better life, but it's also for our representatives so that they have a way to earn an income while they're doing something that helps people. But it's also for our practitioners, a better life for them, a better life for their staff by increasing their income and being able to offer therapy that doesn't include pharmaceuticals, that doesn't include always surgery. I mean, sometimes those are necessary, but to have a choice, I think, makes a big difference. So, while every practice is different, we think that every practice wants to do the same thing, which is increase their revenue. The power of the body to heal itself is amazing. I mean, you can do the surgery, you can do the pharmaceuticals. One of the reasons I love Dr. Dan over here, an alternative medical doctor, is because he looks outside the box, right, Dr. Harris? As I said today, there is no box. You don't have to worry about looking outside the box. There is no box. Take a look at the patient, see what that patient needs, see if there's an alternative to the pharmaceuticals and the surgery, and then do what they need to do to be fixed. So we've designed this to make the therapy affordable to as many people as possible. So I'm just going to give you an example. The lab that we were using out of Irvine, California, they had other distributors before they came to me and asked me to take this nationwide. Their other distributors, if they use 1 cc of the product, which is 5 million live cells, they start their pricing at $7,000 up to $15,000, and that doesn't always include the evaluation. We, to our consumer, to our patient, our 1 cc product maxes out at $3,000, and that includes everything, the therapy, the evaluation, drawing blood if they need to draw blood. We put $120 extra in there just for the cost of maybe some little incidentals there in the office, because we want to make this affordable to as many people as possible across the United States. So our 1 cc is less than half of their starting price. So it's kind of like the Walmart theory, where we sell a lot more for a lot less. So what our program does, we use the umbilical cord blood cells. We simply infuse back into the body those cells that when we're little, naturally are found in our bodies. As we age, we don't have as many stem cells in our body. When we're born, 1 out of every cell in our body is a stem cell. By the time we hit 30, 1 out of every 250,000 is a stem cell. By the time we're 50, 1 out of every 450,000 is a stem cell. And by the time we're 80, 1 out of every 2 million. So our process is simple. It's normally an IV push or just a local injection, just to simply put those stem cells and those other regenerative cells back into your body so your body can naturally heal. How well it's going to work on each person? It's going to change for every single person. If we do 1 million of these, we're going to have 1 million different results. It's going to depend on the person's age, their weight, the condition they have, how many conditions they have, how long they've had those conditions, what's the stage, how bad is that condition. So it's going to change for every single person. So one of the things that we make sure that we don't do is we don't promise any guarantee of results for any individual. But we do know it's not going to hurt them in any way, so why not take the shot? Why not give it a chance to see if it will help them? So, for a doctor, let's say you're a practitioner, after the initial evaluation, let's say you want x-rays, they can bring x-rays if they've already got them, they can bring an MRI to you if they already have it, they can bring their lab results if they already have it, or you can request that. But once you've gone through that initial evaluation and ordered what you think they need, the therapy literally takes 20 minutes or less in an IV push or a local injection. The good thing is, side effect-wise, less than 5% of our patients experience mild flu-like symptoms for less than a day. I had one gentleman that was a little flushed one day, but then we found out he hadn't had breakfast, he hadn't had lunch. Dr. Dan got him a little box of juice, and he was immediately fine. So, common sense needs to prevail, so we tell our people, make sure you sleep the night before, make sure you have breakfast, make sure you have lunch, don't come on an empty stomach. Some people get queasy at the sight of needles. It has nothing to do with the therapy, it has to do with the needle, So those are the things that we have to make sure that we take into account, so that way they have the best possible experience when they have the therapy. All right, so what are some of the conditions that regenerative cell therapy helps from the umbilical cord? You can tell me if I missed something, you can tell me if I got something on here that's not true. Because I keep saying, I'm not a doctor, and I'm getting educated by different scientists, by different labs, by different doctors, and some of the information's the same, and some of it, there's a contradiction. So I need to be talking to people that have been doing this for a while, so I can make sure I'm getting the real answer. So you can see that it helps a lot of different conditions. Once again, how well it helps a particular person and their particular condition is going to change per person. So if you talk about something like Parkinson's disease, before I met Dr. Dan, I didn't think there was a lot of hope for Parkinson's disease or MS or anything that had to do with the brain, because only about 3% of those cells are going to end up in the brain or in the spine. Dr. Dan uses a therapy that actually does a nasal mist spray, sucker-upper. How do you do that?
Just drops.
Drops.
Implant.
And so if I give him 20 million or 4 cc's of the product, he takes 3 cc's, does an IV push, takes another cc, and he does it nasally. He adds a little bit DMSO to it, so that way it gets absorbed up into the brain. He treated a patient with MS just a few weeks ago, and I think it was about a week later, and she was ecstatic because this brain fog that she'd had for so long had lifted. And so she said just that alone, it has made her so excited to continue therapy down the road, you know, as she goes on. So here's a couple pictures of what the cell therapy can do. This one on the left, this lady burned her hand really bad. This was about 6 weeks after she burned it. This one on the right did an IV push, and this was about 4 or 5 days afterwards.
Wow.
Yeah. Yeah. So now the gentleman that did this therapy, he owns Invitrix, and he started in the industry about 30, 40 years ago trying to find a formula to help burn victims. So, and he created using the amniotic fluid and the membrane to create a patch
Okay.
that would help with that. But he ended up doing an IV push here.
Question,
Yes.
did he do the IV push right away, and did he put anything topically on the burns?
You know, I don't think he did. When I asked him, he said it was just an IV push. He said she came to him after 6 weeks. He did the IV push. This was 4 to 5 days
So
later.
nothing topical?
Right.
Okay.
Even though that was where he started out in the industry. This is somebody with psoriatic arthritis. This gentleman, also a doctor. And he had these lesions so bad for so long that he had to wrap his legs, his whole torso, his whole body in cellophane just so he could go to work, because he was in so much pain his clothes couldn't touch it. So this was still, you know, Hippie Torphy, the owner of the Invitrix lab, gave this gentleman 120 million live cells multiple times rapidly. He said he knew he was going to be pushing the limit on what he needed to give this gentleman, but he was actually suicidal and wasn't going to make it a whole bunch longer. To get to this point took about 1.5 years, just to be honest, okay? This is the same doctor right here. This was the lesions on his body. So about 1.5 years, started out with 120 live cells multiple times in rapid succession, and then he could start slowing down. He's alive and healthy and very happy that he ended up, you know, having the regenerative cell therapy. So, you guys are all the doctors, so you know this better than me, but I'm going to go through it anyway. The types of stem cell therapy, the adipose, sucking out your fat, putting it in a centrifuge, spinning it around, adding the enzyme, putting it back in, right?
Yeah.
Do I have it? I might have simplified it, but that's, okay.
You make it a lot quicker.
Pardon?
You made it a lot quicker.
I made it a lot quicker. How long does it normally take to do
It
that?
depends on how much they're doing. Do you do that as well?
The adipose, no?
I mean, usually the product, depends on how much fat you start with, but the enzymatic digestion is about an hour.
I gotcha.
So I mean, it's a 2 or 3 hour procedure to get to the stem cell.
I wouldn't want to do that, I'm just going to tell you. You know what I mean?
Actually, most people love to do that because they like to wear smaller pants. So
Oh, okay,
they're happy
well,
to
You don't have to
donate.
worry.
All right, put me down for that, all right. All right, so then there's the amniotic. Here's the thing. you guys probably know this better than I do, but it's not a stem cell. It's regenerative cell, but not a stem cell. There are a lot of companies out there saying that stem cells. As a matter of fact, Mark and I went to a presentation in St. George, Utah, where they went on and on about how it's a stem cell and how umbilical cords aren't, but there's amniotic. Then there's the embryonic, which of course is where all the controversy is and is illegal in the United States. We don't do that. There's the bone marrow. Ouch, that doesn't sound like it's any fun either. You know, it sounds to me like that's awfully painful. And then there's the umbilical cord, which is the multipotent, which is what we use. Now the reason we use the umbilical cord cells is because, to simplify it in a marketing term, it's turnkey. There's no pain to the mother or the baby, and it's already been, whatever's going on was already going on anyway. There's no pain to the patient other than a little poke when they do the IV push or the local injection. It's easy. There's no HLA marker protein on it, so you don't have to worry about that. There's no blood, so you don't have to worry about the blood matching. So it's a turnkey solution for people. There's no pain to them, there's no downtime for them, and our process is a lot less expensive for them. So for the people that maybe want the adipose but can't afford that, this is a good solution for them. So FDA approved versus FDA certified. I'm going to let Dr. Dan and Dr. Harris talk about that a little bit more than I do, because there's confusion about what the FDA does and doesn't do, and if our product or the industry is FDA approved. It doesn't need to be FDA approved because it's not considered a drug unless it's more than minimally manipulated. The umbilical cord blood is minimally manipulated, so it's not considered a drug. So we don't have to be approved, but we should be certified, we should be registered, we should be compliant, and we are. That's her. All right, so the FDA has released guidelines on how to use stem cell therapy and regenerative cell therapy, and we follow those. The FDA says that you can use any drug off-label as long as the physician is using good common sense. And so we provide an FDA-compliant solution to people that don't want surgery, that don't want pharmaceuticals. So what do? What does lifestyle cell therapy do? Well, we provide training and education on the regenerative cell industry to practitioners who want to add this to their practice. We provide the product for them. They can sell it to their patients, or we can sell it for them and send them new patients, or they can put our contact information on the promotional materials and we'll actually sell their patients for them. So we actually help them build their practice that way. So in a nutshell, that's what we do. We help you build your practice by adding this therapy to your practice. So, as I said, not including the evaluation, it only takes about 20 minutes. It's an IV infusion of the live cells derived from the live, healthy born baby. It can be administered as a direct to the site or a local injection, like a kneecap or a joint or something like that. The reason you do a local injection for a joint, not a whole lot of blood flow, so you get it direct to the site that way. Help repair that. An IV infusion, anywhere from normally 5 to 20 million live cells. A local injection, normally anywhere from 5 to 10 million live cells. Okay, so the therapy process. You start with the evaluation or the consultation. You order the product and we set the appointment date for the patient. The product is delivered the same day the therapy is going to be administered to the patient, unless you have a freezer that's minus 80 degrees Celsius. It gets delivered, it thaws out right in your hand within 5 minutes. It comes frozen, packed in dry ice. You administer the therapy, and then you follow up evaluation, just like you would do any other diagnosis for any other condition. The same protocols are in place to make sure that your patient receives the best care. So what are the protocols? It's stored at a minimum of 80 degrees Celsius. For transportation, they're placed in a styrofoam cooler, packed in dry ice, and then shipped via Federal Express. If you have a freezer, as I said, then you can stock it up, or it can be delivered ahead of time. If you don't have the freezer, it's delivered the day of the therapy, because it has to be used within 24 hours. The vials defrost quickly. This is what they look like. Is that what yours look like as well?
Well, similar.
but close to that, okay? Yeah, this is 1 cc, that's 2 cc's, so if you wanted to, you could use 2 of these to get 2 cc's, or you can use 1 of these to get your 2 cc's. And then it's administered through an IV push or a local injection. So, Lifestyle Certified Network, what is that? Well, as I said, we provide training to all of our practitioners to make sure everybody has the same fundamental information. I realize as doctors, you're going to know a heck of a lot more than I do about common medical, everyday doctor things. But for the stem cell industry, for the regenerative cell industry, certain protocols that need to be followed, we provide training. It's just a 2-hour workshop to make sure that you have all the information that you need, that any questions you have are answered. With that certified network, we give you medical malpractice insurance for stem cell therapy. Now, there are a lot of doctors out there that will add different procedures and therapies and whatevers to their practice, not realizing that if they have a material change in what they're doing, their medical malpractice doesn't cover it. I started out working for Farmers Insurance out of this district office, so I knew that that needed to be put in place. So we created the first ever standalone medical malpractice policy for stem cell therapy. And then you can get that as part of our membership. So it's an annual fee. With that, you get the membership, you get it's a 2-hour workshop and then a 2-hour webinar if you want to attend that. We give you promotional materials on the lifestyle cell therapy at my hard cost. We don't mark it up a penny. Whatever it costs us, you get it for. You can put your practice information on it, or you can put our contact information on it and we'll sell it for you. You get the promotional marketing and support. You can send your patients to our live presentations. You can send them to our webinars if you want. We'll support you that way. We'll give you your own landing page on our website so that if somebody's researching a doctor and they want to see if their doctor happens to be a part of our network, you're on there, that's great. If not, we'll get you added. You have access to financing for freezers and product. Let's say you want to add a freezer. The freezers, depending on what size you get, start at only about $5,000. You can get them used, just make sure that they've got some life left in them. And then you get the medical malpractice coverage. The fee for that, hold on, let me go back one. Let me go back for one. Is $2,200. That covers everything. Now, when I first started working with the underwriters out of Chicago to create this medical malpractice policy, they told me that if somebody added a rider to the current medical malpractice policy, it was going to cost them a lot more than $2,500 annually for that. They said if they were able to underwrite it and individually insure a doctor, it would start at least at $2,500, depending on the history of that particular doctor or physician. So for us, because I kind of had a little in working for Farmers Insurance, and I knew the underwriter, we flew him out here, we created a master policy that allowed me to pass on my discount to all of our practitioners that are on our policy. So it's only $2,200 annually, covers medical malpractice, your training, and your marketing. All right, so our packages. We have 3 different types of packages. Consumer direct, we actually sell it directly to the consumer because we call them an orphan. They don't have a doctor that's doing the cell therapy, so we're going to sell it to them and we're going to match them with a doctor and send them there for the evaluation and the therapy. That's called our consumer direct package. We've got 4 different sizes, 1 cc, 2 cc, 3 cc's, 4 cc's. We sell it to the patient for $29.50 for 1 cc. We pay the doctor $770 every time they do an evaluation and a therapy. So it takes about 30 minutes of your time. You make $770 cash. This is not an insurance paid thing. This is a cash paid evaluation and therapy. So we've done all the work. We found the customer. We sold them the package, pay for all the marketing and everything. We pay you so we're going to pay you to bring on a new patient into your practice. Regardless of what, how many cc's they get, it's $770 to the doctor the day of the evaluation and therapy. Our patient prices, as I said, 1 cc is under $3,000, 2 cc's is $44.50, 3 is $56.50, and 4 cc's is $66.50. So even our top of the line platinum package is less than the other distributors that are selling 1 cc at $7,000 without the evaluation, without the therapy. So you can see we've kept our prices really low. Now, regardless of which doctor we send our patients to, we charge the same price always. We want to make sure we don't have one doctor out there discounting this so low that's making it harder for the other doctors. We don't want a doctor out there raising the prices so high that it's distorting the value of what we do. So, the professional marketing. Remember I said you can put our information on your promotional materials. They call us and we'll sell your patients for you. If that's the case, we're going to sell your patient. You don't give us your patient list. You don't have to worry about HIPAA or anything like that. They're going to contact us because our contact information's on your promotional materials. We'll provide the product. Everything's turnkey just like it is as if we sold an orphan. So, same thing. We're going to sell the basic to the patient for $29.50, but instead of giving the doctor $770, we're going to give the doctor $1,070. On 2 cc's, we're going to give the doctor $14.70. On 3 cc's, we're going to give the doctor $18.70, and on 4 cc's, $27.70. Basically, what we're giving you is a lead fee in there. That's why it's a whole lot more money, because it was your patient to start out with. It was your lead, so to speak. And then if you sell your own patient, you are going to sell the patient for $29.50. You're going to buy the product from me for $13.50. So you made $1,600 off that. If it's 2 cc's, you're going to sell it for $44.50. You're going to buy the product for $19.50. You're going to make $2,500. And at 3 cc's, you make $3,300. And at 4 cc's, you make $38.90. So, potential revenue. Let's just go with right down the middle and say it's 2 cc's, not even the 4 cc's. If you sell the 2 cc's and you do 5 of those a week to your patients, that's 20 a month. 20 times $2,500 in revenue to you is $50,000 additional revenue to your practice each month. All right, so our data pool. I originally wanted to figure out a way that I could give a referral fee to our doctors. If they sent me another doctor that got registered into our program, I wanted to be able to give them a referral fee. Found out I can't do that, that's illegal. So what I did is I created a data pool. With this data pool, I take $20 for every sale that we make, goes into the data pool. In order for the doctor to be a part of this data pool, they have to be a part of the Lifestyle Certified Network, so they've got a membership going there. Plus, with every product, we will provide a return postcard that has some basic information on it. You have a little label that just has a patient or a product ID on it. Don't have any patient information on it, so you don't have to worry about HIPAA again. And then just tell us, was it male or female? What is the basic age range? How many cc's did they have? What were the conditions they were trying to treat? Was it an IV or was it a local injection? That will give us some data to start seeing how this product is being used by the doctors and by the consumers out there. Since the doctor is giving us something of value, now they can share in this data pool. So that's how I'm going to reward the doctors and do it legally. All right. 2% of every sale that we make goes into our charity called the Magic Wagon. Even though this charity is designed to help people who need the therapy but can't afford the therapy, whether it's they need to get here, they need to go to a doctor, maybe they can't afford any of it, maybe they can afford the therapy but not the whatever, that's designed to help them with that. But we're going to help other charities as well. So if anybody has a good charity that they want to put on our list of charities that we help support, let me know, because we'll vet it, make sure it's a good charity, and then we'll add it to our pool of charity recipients. Thank you everybody for coming. Thank you Dr. Harris, thank you Sherry, thank you Dr. Royal. Thank you all of you guys for coming to be a part of this. If you have questions, just let us know, and be safe going home. Thank you.